Chronic obstructive pulmonary disease, or COPD, is a disease that millions of Americans live with every day. COPD causes its bearer to have increased shortness of breath as life progresses. There is no cure for COPD, but those that have this condition can focus on improving their everyday lives through the tertiary prevention of improving their nutrition, quitting smoking, medication adherence, and exercise. In this short presentation, we will focus specifically on how a person with COPD can include exercise in their daily lives. With COPD comes a cycle of events that could cause you to want to exercise less and less. With the increasing shortness of breath, you might start to avoid everyday activities that make you feel breathless. With the lack of these activities, your muscles could start to weaken, which unfortunately would lead to more breathlessness. All of this could lead to depression, leading you to participate even less in the activities that you previously used to enjoy. With exercise, you could slow down or break this cycle. Numerous controlled studies have shown that exercise in the COPD patient can increase independence in everyday physical capabilities by decreasing anxiety, depression, and breathlessness, improving brain function, and decreasing fatigue in everyday life. Before anything else, meet with your provider to discuss starting an exercise plan. Your provider will assess your current state of health and recommend a safe level and duration of exercise. Your provider might prescribe supplemental oxygen as well as other medications which could open up your airways and help you breathe better through exercise if needed. It is important to follow your provider's guidelines for exercise success. Next, choose an exercise that you enjoy. Good choices for those with COPD may include walking, swimming, lifting hand weights, or using a stationary bicycle. If you are too short of breath to engage in these activities, chair exercises are also a good option. This is the dyspnea scale, a subjective scale you can use when exercising to measure the amount of shortness of breath. A 0 on the scale means that you are having no difficulty breathing, whereas a 10 means your shortness of breath is extremely severe. A good goal is to keep your dyspnea level between a 3 and 5 on the scale during exercise, unless your provider advises otherwise. Remember, shortness of breath is okay as long as you can talk through it and are in control of your breathing. If you are not, slow down and stop and rest. If at any time you experience severe shortness of breath, chest pain or discomfort, unusual pain in your shoulders, arms, neck, jaw, or back, a racing or skipping heartbeat, or lightheadedness and dizziness, it is important to immediately contact your provider or seek emergency medical assistance. Otherwise, during exercise and mild to moderate shortness of breath, you could benefit from using pursed-lipped breathing. With COPD, a lot of the breathlessness is experienced from something called air trapping, which is being unable to effectively remove air from inside your lungs. Feel free to follow along as I guide you through a round of pursed-lipped breathing. First, breathe in slowly through your nose for 2 counts. As you do so, you should feel your belly getting larger as you breathe in, using the large muscle under your lungs called the diaphragm to assist your breath. Pucker your lips now as if you were going to whistle or blow out a candle. Now breathe out slowly through your lips for 4 more counts, making certain that you are not forcing your breath. Repeat these steps until your breathing slows. Always remember to warm up before exercise with stretching. Pace yourself during your workout and to cool down at the end of your workout with a lower level of exertion and more stretching. Also, always make sure that you are drinking plenty of water to keep hydrated and help the mucus in your body stay easier to cough up. Keep your rescue inhaler with you and use it if you need it. Make sure you contact your provider if you have any questions or concerns. Most important, have fun and enjoy creating for yourself a healthier life.